What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the pros and cons of cross-training into modalities right out of X-ray school without having any chance to work the actual X-ray tech field. So the pros and cons. So to give you context, I am a night shift X-ray tech. Been doing it for about 4 years, and I work a bunch of overtime. And I've talked to many techs, both who've been veteran, both people who've been new and just straight to CAT scan or straight to IR or straight to cath lab, different modalities straight away, and then other ones who've gone the other route, more traditional route, I guess you could say, where they went through the X-ray, they worked it, did a few years, then they cross-trained or actually went back to school and learned it. So each one has their pros and their cons, So some of the pros, if you go straight from X-ray school, let's say that you feel that you don't like X-rays, that all you want to do is cath lab, CT, whatever, and that's what you want to do, you want to just jump straight to it. So the good part is some places offer you that opportunity. Some hospitals, some clinics, they offer that kind of chance. Other places offer you a different type of route where you have to first be a regular X-ray tech, and then with time they could cross-train you, maybe like on your days off, or you could do both where you mainly do X-rays and then you also dabble in the CAT scan as you learn and cross-train. Some places offer that. Other places, if they're like really deep in need of CAT scan techs or other techs, they will allow you straight out of X-ray school, jump straight into the modality and just learn on the job, which, I mean, it's pretty good because you learn how to actually do the job and you get hands-on experience, which is always valuable. You don't really learn the actual textbook side of the, like all the stuff that you learn like in school, the actual education side. You have to do that on your own. Obviously there's courses, there's classes that make it possible for you to learn, but it is kind of on your own. Most places they want you to, they give you about, I think, a year. Some places are even shorter to get all your comps and prepare for the registry. Some places make you sign contracts saying that so-and-so date you promise to finish everything and sit for boards, or else you'll be let go from the actual, cross-train modality type of work. And I mean, your pay will be significantly less without your actual credentials. I mean, some places it's $5, some places it's like $7 to $8 less than the actual certified tech. That's what I've seen just in my places, which is, I work at the Trauma 3. For instance, like if you want to do CAT scan, X-ray and CAT scan are pretty similar as far as like positioning goes. You may have to tweak the tube and stuff, obviously a little bit different. There's other stuff, but as far as just like the general overall, we're similar scans. It's just having to deal with more contrast, and there's different slicing and different stuff that makes it completely different. But I would say it's a good foundation to have and makes it easier transitioning. If you want, like CAT scan, I would say CAT scan is the most easiest to transition to from X-ray, because you have, it's kind of like similar-ish realm. Obviously there's different scans and stuff. That's why they're more complicated and get paid more. But it's a good starting point. It's easier to transition into that versus transitioning into like cath lab and IR. So I would say it is good to have some level of experience, because like if you're straight fresh from school and you have no experience of any type of workforce, and then you jump into a higher modality like CAT scan, cath lab, and all those other modalities are more heavily, well, I guess CAT scan not really, but the other modalities are more like you're gonna sit there with the radiologist and perform exams. Some of them even require multiple Like you'll do both like CT and ultrasound, and you'll like whip out different stuff like in specials or interventional radiology. Sorry, you'll use different tools to get the job done, which is more hands-on, and you do a bunch of things, and it gets a little bit more complicated. So if you go from like just knowing x-rays and not jumping into the workforce, you'll feel a little bit overwhelmed, and you'll feel a little bit kind of swamped. I would say that's some of the cons, because like if you already have some years under your belt of just x-rays, you kind of understand the overall work, like how like the emergency works, how like emergency room works, how old like the doctors operate. You can like, you have a good well-based understanding, and you won't completely be blindsided, or you won't feel overwhelmed. You'll kind of be able to keep up with the pace. Like just in my hospital alone, some of the techs who've gone from students straight into their special modality, some of them have struggled. There have been, I've seen it several times where some of them like struggled, they didn't pass the test. Some of them just didn't end up, they tried like 3 times and they weren't able to pass at all, like from like to sit for the registry, and they ended up having to go to another hospital or just come back to regular x-ray. So that is that. I've noticed some of the people who go the more traditional route, obviously it does take a little bit longer and you probably do have to pay more, but you have a good, like, you go back to school and they teach you the traditional route. And some people, I'd probably go down that route. I'd feel like I'm a person that would have to learn that way, but some people just do better if they learn on their own and go their own pace, and it's more flexible, I suppose, the like training on the job type of stuff. So in conclusion, I would say, depending on what's available at your hospital, if you really want it and they have it, you can always give it a chance and go dabble in whichever modality you want and give it a shot to see if that is the right choice for you, and if you like it. And if not, if all things fails, you can just go back to regular x-ray. But just know, certain places, if you jump straight into a special modality, it's going to be harder for you to back out sometimes and go back to regular just x-ray. Some places have it. I've seen some places where if you're already kind of pushed, like jumped into a certain place, they'll try to keep you and try to find ways to keep you there instead of going back just to regular. And some places I've seen, if you want to dabble in both, some places won't allow that. Like there's been some techs at my department that want to be just a full-time like x-ray tech, and they want to also just like maybe on their days off, or maybe like just dabble on both teams. And if they're like, when they're still training, you know, some of the places don't, they literally told them they can't, they have to like just do CAT scan, and they couldn't dabble on both unless like we're super desperate. I guess they'll probably allow them, but that's just what I've seen at my places. And to each their own. I mean, there's been some places where you could, how do I say, where you could dabble in multiple modalities, and as long as you're getting your certifications, they'll allow you. But some places, like if you just go into CAT scan, they kind of keep you there, and they won't let you branch out into the other modalities until you're actually certified. And even if you are, then it's kind of hard for them to let go of you into the other modalities at the hospital, or they won't give you that many hours. That's what I've kind of seen. But I would also pay attention. Most of the times I've noticed when they're actually offering an opportunity to cross-train, ask questions, pay attention, because usually they want people who are certified because of like legal stuff. They want people to be certified because once again it keeps them safe, and because you know what you're doing. Ask questions, pay attention before you sign on, because most of the times I've noticed in all the places I've been, if they're cross training, if they ask you, usually it means they're desperate because they can't find techs, or they don't have techs that want to do it, or some of the techs who were there and actually had certifications, they felt maybe the job was too much for the pay, or they didn't like it, or there was some reason. And always HR is always looking for the brand new batch of willing to do it, who doesn't know as well as the actual certified techs in like the upper modalities. They'll just grab them just to have someone fill the role for a cheaper price, like pay wise. So always pay attention, ask questions, do your research, because there's been times even at my hospital where certain techs that have been there for a long time, certified, some of the newer techs, no credentials, no nothing, almost come in making the same amount of money, or even once they get certified they make almost the same as some of the other techs, which kind of messed up. So especially if your hospital is offering cross-train and you're actually one of the techs in the higher modalities, pay attention, ask for more money, or just keep an eye out, because ain't nothing would be more make you mad if you've been doing it for like 5, 10, whoever how long years, and then someone comes in fresh out of school making almost as much as you do. So keep your eyes out. Yeah, it's been your boy Miguel. We'll see you on the next